About 30% of Americans are fully vaccinated against the coronavirus, but the Surgeon General says there's still a big part of the country that remains unvaccinated. The pause in the Johnson & Johnson vaccine has really created some hesitancy as well. The Washington Post is reporting among people who are unvaccinated here in the United States, not even 25% are willing to get the J&J shot. Today, we are answering your questions about the vaccine, whether it be the J&J or the other two, Moderna and Pfizer. Our phone lines are now open. The number is now going to be scrolling at the bottom of your screen. And Melanie, you're with Dr. Pam Rama from Baptist Health to get some of the answers to these questions.
And we have a ton of them, Jen. I am so proud of our viewers because you guys are kind of stepping out there asking things that you're uncomfortable with about the vaccine, and we get it. So the number to call, 346-4630. There's also the 800 number that you can call. Thank you. We hear those phones ringing. I want to bring in Dr. Pamela Rama with Baptist Health Specialist. Dr. Rama, we got some really good questions. You took a look at them beforehand, and you were impressed with some of them as well. I want to talk about people who are having certain side effects that they feel like are related to the vaccine. And what if it's, 2 weeks down the line or a month down the line? One in particular, this person didn't want to be identified, but they said they had the second Moderna shot on April 14th, and they've been tired ever since. 87 years old. She said she normally has a lot of really good days during the week, but since the second shot, she said she's not had a good day, and we're talking about 2 weeks from now. So people hear that, and then that makes them nervous. So is it the vaccine, or could it be something else?
Yeah, so God bless her, 87 years old. So, the vaccine, you will expect some reaction from the vaccine because it means that you're building up immunity towards to the coronavirus. Usually the side effects last around, 5 days to 7 days. So if you have symptoms beyond that, you may have to seek medical attention, make sure that nothing else is going on.
I mean, with millions of people getting the shot, you are going to have sometimes those coincidences. We see that with the flu vaccine, where someone thinks, oh my gosh, I got the flu after I got the vaccine, but they could have had the flu prior to getting the vaccine.
Right, and remember that. So you're not protected within the first few days of getting the vaccine. So you could have had a COVID infection. And so, if the symptoms persist more than a week, I would say seek medical attention, and you may need to get the COVID testing done.
Okay, all right. This is from Neil. He said, why should someone who contracted COVID-19, who got better, now has the antibodies, get a vaccine? And why don't they do that for other illnesses?
So because, there are different levels of infection of COVID-19, right? Some people have mild infections. And so we don't know the antibody response. There's a lot of heterogeneity when it comes to individual patients. So some people can have a robust response and some people can have a mild response. We don't also know how long the immunity is going to last for, especially if you'd had a milder symptom. It may not last as long as the vaccines. Now, the good thing about that vaccine is they're very consistent. So a lot of them give you 95% protection. So it's very consistent. And we know from the recent studies that it extends to up to 8 months. So, so you want that. So even if you've had the COVID infection, the recommendation is to get the vaccine when you're out of your quarantine period.
Okay, and that is a question that people have. They've had both shots, and they're wondering how long their antibodies will stick around. So this is a question that addresses that, saying that, they definitely had both vaccines beyond 6 months. Should they be tested for antibodies at that point, or should they expect a booster, and how is that going to work?
So there's a lot of, debate among virologists about this. Some people are hoping that this is like the polio vaccine where you get one shot and you're protected for life. But more likely it's going to be a shorter term. And we're hoping it's not like the influenza where you have to get it every year. So at this point, it is 8 months immunity, and it might extend. So we're following the first cohorts of patients who've received the vaccine. And hopefully it's going to last longer than that. But I wouldn't be surprised if you're going to need a booster somewhere down the line within a year or so.
Right. Okay, I want to address Penny's question in Nocatee. So she said she had both vaccines, no issues, but now she's hearing that coronavirus has a 99% survivability rate. So what does that even mean? And she said she's afraid she might have made the wrong choice because if she got COVID, she would have been okay.
Well, no, she made the right choice. Getting the vaccine is the right choice. So most patients patients who get COVID are going to survive it. But we kind of get the skewed view of it in the hospital because we see the sickest patients who get it. There's a couple of things. First of all, you could be one of the patients who are going to have a very hard time with the virus and need mechanical ventilation or be hospitalized for it. And the second thing is that you don't know the long-term side effects of the medications, of the vaccine rather. Of the virus. We're already seeing patients who are coming to us, 3 months after they've had the virus, who are complaining of cardiac issues like shortness of breath and some chest pain. So there are the long haulers, and there are the people where they're going to have long-term side effects from the COVID infection, and we just don't know what it is.
Yeah. And look on news4jax.com because Vic Micolucci did a story about that, and you really can look at the long haulers, and that's something nobody wants to deal with. Okay, so behind us, these phones are ringing. We have a lot of questions that are coming in that we are going to address. Dr. Rama, I'll give you these two so you can take a look at them. Again, the number to call 346-4630. There's also an 800 number. We are answering your questions this morning, so keep those calls coming. We'll be right back after the break. We are taking your questions about the COVID-19 vaccine, and these phones are ringing. I want to address Lorraine and Larice at the same time. They both are asking if you've had a heart attack, or this one in particular, living with diabetes, should you be vaccinated? Also, she said that she was having heavy heart palpitations after getting the Pfizer vaccine. Is that normal? Could the vaccine have caused that?
Yeah, so for the first question, if you have a heart attack or diabetes, those are the highest risk patients. So they are the ones that tend to run into trouble with the COVID infection. So definitely have the vaccine. As far as the palpitations, we are seeing that. So we are seeing some palpitations in patients who've had the COVID vaccine. And I think that's just one of the reaction of the vaccine, especially if it's within the within the week of getting the virus.
Beyond that week, that's when you may want to raise some questions.
Absolutely.
And then again, would that be vaccine related?
It could still be vaccine related, but if it's beyond, a week or so, you need to seek medical attention, make sure nothing else is going on.
All right, and also something I just want to point out, because we had someone ask a bunch of questions about rashes. Yes. And you said if you see a rash within that 4 hours, then that probably is vaccine related. And what should you do?
So we are, of course, we don't know the allergic reactions to this vaccine because they're very new compounds, right? And so if you have a rash or develop a rash or hives within 4 hours of getting the vaccine, that's probably an allergic reaction. And you have to seek medical attention right away because it can, cause an anaphylaxis wherein you're having difficulty breathing. So within 4 hours of getting the vaccine.
If it's later?
If it's later, it could be just the natural reaction to the vaccine. So, the virus or the proteins are injected in the cells, and including the skin cells and the muscle cells.
Okay, so if it's later, you don't have to worry as much. Dr. Rama, thank you. I'm going to hand you these so you can look through them. We have more coming.